Thanks.
Good evening, JEFCO Board of Directors. My name is Lorraine Barnes, and this is my 27th year working in JEFCO. My husband and I and our 6 children are all proud graduates of JEFCO schools. We are the JESPA and JCA Committee for Reclassification for the Health Aid position. We are presenting tonight a petition and a proposal for the job of health aid, and that has been signed by 93% of our health aides in the district. We are the lowest paid office staff personnel. We are delegated yearly by our district nurse to perform job duties and procedures as a health aide that a district nurse can do, such as and not limited to diabetes, seizure, allergy, asthma, concussion, catheterization, G-tube feedings, oxygen, diapering care, daily meds administration, data entry of immunization records, hearing and vision, outdoor lab, just to name a few. Because of the low pay, many health aides in the district will either quit the job or seek a higher paying position such as an attendance, financial, counseling, or principal secretary position. And sometimes that's just even in their own school, not just in the district, but actually in their own school. With the large number of health aides that there are turnovers in, it puts undue stress and more work on our district nurses. And it costs the district to rehire, retrain new health aides. Our district nurses are already spread way too thin by having to cover 2 to 3 schools instead of just one school. And they have to retrain the health aides over and over again. In this book here, I just kind of, as a visual, it just basically shows that this is just paper, basically we have a lot of different paperwork in there that all has to be filled out by parents. We have to be delegated in all these procedures to some of the ones that I named. So we need to make this reclassification change, and we need to make it now. And we thank you for your time tonight.
Hi, my name is Natasha Davis, and I'm a health aide at Three Creeks K through 8th. We currently have 1,100 students in the school. A typical day for our health room will approximately 55 to 75 kids a day for head bumps, cuts, grazes, injuries, toiletry, bloody noses, fever, fights, broken bones, etc. No 2 days are ever the same. On top of that, we care for 7 diabetics, 8 daily meds, and help cover the reception and phones when admin are short-staffed. It can be a very stressful environment at times, and because of this, dedicated health aides are hard to come by and even harder to keep. We complete many delegations and trainings so that we have the knowledge to care for these kids. We are not simply applying Band-Aids to cuts and grazes. For this reason, listed above, 93% of health aides across the district have signed the petition to demand reclassification. We deserve higher pay, better benefits, and more respect for all the work we do. This is why we are delivering this petition to you tonight, and I hope that you will hear our voices and take us seriously.
My name is Trish Miller, and I'm the health aide at Golden High School. And I'm here to support the reclassification of the health aide position. The position encompasses so many things more than Band-Aids and ice bags. For many schools, a nurse is not on site most of the time. Nurses have several schools they manage, so health aides are delegated to carry out the health and medical tasks under the nurse's license. Health aides have to stay current on many certifications and trainings, and because we are working under a nurse's license to do these things, for our benefit and the benefit of the kids and the benefit of the school district, it would be beneficial to have this job reclassified at the level it deserves and not seen as a mom job or a stepping stone job to some other job in the district, as they pointed out. It's an important job that carries potential liability to the school, to the nurse, and the district. And if the job was reclassified, nurses would have less turnover of their health specialists working under them on their nursing license, and would not have to train new people frequently, leaving them to focus more on their own nursing responsibilities of managing care of multiple schools. All of us are asking you to please see what this position encompasses and classify it and compensate it accordingly.
Hi, my name is Helen, and I'm the health aide at Elk Creek Elementary. I've been there for a year. I love my job and what I do. However, I'm a single person who lives paycheck to paycheck and have found myself barely getting by this past school year on what I earn. And I don't mind telling you, it's been a hard year financially. I'm here along with my fellow health aides to demand the JEFCO board consider a reclassification for the health aide position to include a revised job title, better pay and fair wages for the work we do, paid time off, and the recognition and respect we deserve. The work we do to help keep the kids healthy and to keep them in the classroom. Learning is so varied. We care for diabetics, kids who have seizures, concussions, bloody noses, falls, bumps, lice, cuts, sprains, vomiting, headaches, beads stuck up noses, objects in their ears, dehydration, a lot of that, lack of sleep, nausea, and yes, ice packs and Band-Aids, which are the very least of it, actually. And the medical training for this multifaceted position is extensive before delegation by our nurse. Another part of my job is the work in the front office, helping with any administrative tasks that need doing. I answer phones, helping parents with questions, directing them where they need to go. I buzz the parents and the kiddos in the building every morning, also help deliver items that parents drop off. Basically, I jump in wherever I'm needed to help, always keeping an eye and an ear open in the health room. Occasionally, I'm asked to get the kiddos off the morning buses or at the hug and go line at the end of the day. I cover fourth grade lunch every day for 20 minutes. I also do the perimeter check of the building once a day, which takes about 10 minutes. I feel the board can appreciate and agree that retaining a health aide who truly cares about the kids and their well-being, who's efficient, reliable, capable, well-trained, and satisfied will financially benefit the district compared to the time spent hiring and retraining a new employee every few months, which is what I've heard happens a lot. And I know the district RN would wholeheartedly agree with this. For all these reasons, myself and 93% of health aides across the district have signed this petition to demand reclassification. We truly hope that you hear our voices, give thoughtful consideration to our requests, and take this matter seriously. I introduce health aide Nikki Saunders from Seacrest Elementary, and she'll now deliver our petition to Superintendent Tracy Dorland. We also have a letter of support from the registered nurses of the district.
Thank you. And do we have a number 3?